Acute aortic dissection is an acute life-threatening emergency condition where there is a tear in the big blood vessels which starts from the heart and supplies all the vital organs of the body. Because of an internal tear, the aortic lumen is converted into true and false lumen, and that can cause malperfusion of vital organs such as brain, presenting as stroke, presenting as abdominal pain and malperfusion of bowel, or kidneys presenting a renal failure, or malperfusion of the limbs causing acute ischemia of the limbs. This acute aortic dissection is commonly present in patients who have hypertension as a comorbidity because of all other causes. It can also run in patients who have familial diseases like Marfan syndrome or collagen vascular diseases. The patients of acute aortic dissection often present with sudden onset chest pain, which can mimic a heart attack, or stroke, or pain in the limbs. The diagnosis of acute aortic dissection is done by an echocardiography, which shows that there is a flap in the ascending aorta which goes down along the lumen of the aorta, differentiating it between true and false lumen. Other confirmative tests to do the diagnosis is to do a CT aortogram. Patients who have pre-existing aortic aneurysms can land into sudden acute aortic dissection. If not treated properly surgically, acute aortic dissections can have a mortality between 80 to 90% or more. These patients who have dissection of ascending aorta reaching up to the aortic root require emergency complex surgery in the form of replacement of ascending aorta and aortic root. Part of arch or complete arch also might have to be replaced depending on the tear, where it is present and how it is going into the aorta. These surgeries are extremely complex and are generally done at a high volume aortic surgery centers like Jaslow Hospital. At Jaslow Hospital, we have a team of experienced anesthetists, cardiologists, technicians who are trained in aortic surgery, where we do 20 to 25 acute aortic dissection surgeries every year. The outcomes of acute aortic dissection surgeries are good provided the patients present early and are diagnosed early, and the surgical treatment is offered in a comprehensive way. 19th of September happens to be the awareness day for acute aortic dissection. This presents us with an opportunity for a common man to understand that a pathology can happen with a tear in his aorta, that's the big blood vessel which is supplying all the vital organs, which might need an emergency surgery. If the tear happens to be in the descending thoracic aorta, we manage them initially with blood pressure medicines conservatively, but if there is any malperfusion or bleeding at that site, or the aneurysm developed in the descending thoracic aorta, such patients are treated either an endovascular therapy or by a subsequent surgery.